Hi, my name is Abby Stormer, and the topic I chose is benefits of exercise during pregnancy. Just a little introduction. Pregnancy induces major physiological and psychological changes. It also can significantly improve maternal and fetal health, yet only 13 to 20% of pregnant women follow the recommended guidelines for exercise. Why exercise matters during pregnancy? Widespread of conditions such as gestational diabetes, GDM, hypertension, postpartum depression are on the rise. Benefits of exercise includes prevention and manage complications, improve birth outcomes, support mental health, encourage postpartum recovery. Key outcomes found throughout the studies that I chose for improving exercise is a decrease in gestational diabetes up to 59%, a decrease in excessive weight gain, decrease in hypertension and preeclampsia, decrease in excessive fetal growth, in type-specific exercises like yoga, walking, running, and aquatic exercises decrease body pain and edema. It also comes with some mental health benefits. A 67% reduction in prenatal depression from exercise. Yoga can decrease anxiety, stress, and anger, especially with a 10 to 12 week program. Dance creates happiness, reduces fear, and improves body image, as well as walking and running decreases depressive symptoms. Exercise improves emotional regulation, sleep, and social support. Here I have created a chart that shows different types of exercise that is most beneficial to those pregnant women, as well as when to focus them on the trimester. For example, the first one is yoga, and it is best to do that in the second and third trimester with the benefits that it lists, which would be a decrease in blood pressure, stress, and increase in pelvic tone. Here, the only one that really have all trimesters can be focused on is walking, running, and dance, which can improve mood and labor pain and other things like that. It does come with some risks, especially if you are unsupervised. Falls and injuries from high-impact activities are very common. The supine hypertension from flat exercises, we want to avoid doing that. And overheating and dehydration are very common side effects. Just be sure to exercise safely and effectively. You shouldn't come up with too many issues. Prescribed exercise guidelines include the recommendations from ACOG, which is at least 150 minutes a week of moderate to intensity activity, spread across most days of the week, and you want to avoid that one position talked about earlier, especially after the 20-week gestation. Tailored plans are encouraged based off of trimester health and history and fitness level. So you definitely want to take in consideration of that. Really encouraging a variety of low-impact exercises. Those that include both aerobic and resistance, and monitoring those high-risk pregnancies are very important. Barriers to physical activity in pregnant women come with internal and external factors, such as fear of harming the fetus, which is a very common one, lack of knowledge, in fatigue, as with the external is lack of time, support, and or not having access to facilities. Some solutions to those barriers would be educate patients on safe options, promote home-based or online classes such as yoga or walking programs, group sessions, or parental fitness classes to increase adherence is also a great option. Long-term benefits for pregnant women exercising throughout their pregnancy is an increased postpartum recovery speed, a decrease in postpartum weight retention, decrease in long-term risks of maternal obesity and type 2 diabetes. We want to improve infant birth weight and neonatal outcomes. In conclusion, exercise is a very powerful and therapeutic tool with lots of broad ranges of benefits for both the mother and the baby. With clear guidance, more women can safely engage in physical activity during pregnancy. And that concludes this presentation with the Works Cited. I found my 2 articles off of PubMed and through the OSU library. Thanks for listening.